So today's disease presentation is on Neisseria meningitidis, which is known to cause what we know as meningitis by Addison Elvin. A little intro into Neisseria meningitidis. It was discovered in 1883 by Wichselbaum. He was able to analyze the cerebrospinal fluid of a patient that had been infected with the disease meningitis. So it's been around for 135 years and continues to appear to this day. In fact, 10% of the population carries the bacteria in their nose and throat, but have no adverse effects or symptoms. So it goes unnoticed. The understanding of this disease since it's been discovered, knowing it's caused a multitude of illnesses, we've been able to identify and study not just its basic characteristics, like listed below, but its pathogenic virulence factors, which from there we've been able to improve evaluation of infected patients and most importantly, vaccine campaigns. Have been able to come out with a vaccine that significantly helps reduce complications. Um, Meningitis has been found all around the world, some places more than others, which we'll get into in a later slide. Some general characteristics of Neisseria meningitidis is that it's prokaryotic, it's aerobic or facultative anaerobe, gram-negative diplococcus, non-motile, non-spore forming. It contains 6 stereotypes, and it attacks membranes that protect the human brain and spinal cord. So general info on Neisseria meningitidis. Like I said, it's aerobic gram-negative diplococci, can occur intracellularly or extracellularly in a certain type of immune cell that we have. It's a fastidious organism, so grows best at 35 to 37 degrees Celsius with 5% carbon dioxide, which, like we've used in class, it can be grown in a candle jar. Its reservoir is humans and only humans, no animals, nothing like that, just humans. And then geographically, meningitis outbreaks occur worldwide. However, the highest instances of this disease is in what's called the meningitis belt, which is sub-Saharan Africa, which ranges from Senegal to Ethiopia. So on the right, I included a little map of the highlighted regions that are most affected by meningitis. A quick question that I included for everyone to think about is some reasons you can predict or come up with as to maybe why Africa experiences the highest risks for meningitis. So just to keep that in the back of your head while we continue. I included this dichotomous key because doing research on this disease, I found it and I thought it was interesting considering we've used a few dichotomous keys in this class, so I thought that was interesting. Transmission of Neisseria meningitidis. The reservoir of the pathogen is, of course, humans, like I said, but specifically the human nasopharynx. Its modes of transmission is through direct contact with large droplet respiratory secretions or saliva. And it does require close contact to spread the bacteria to one person to another. So, like coughing, kissing, sharing a drink, something like that. It contains quite a few virulence factors. One of them is the capsule, which helps in surviving the human's immune response to the pathogen. Pili, which aids as the adhesion factor. LOS, for example, evokes the human's immune response, which leads to endothelial damage, capillary leakage, tissue necrosis, organ failure, and organ failure. Human factor H binding proteins. Those assist the pathogen to survive the immune response, so negatively relates the complement pathway of the immune system. And then there's a few others also listed in there. Signs and symptoms, so can include high fever, stiff neck, severe headache, one that seems a little different than normal, nausea or vomiting, confusion or difficulty concentrating, seizures, sleepiness, difficulty waking, sensitivity to light, no appetite or thirst, and or skin rash. For newborns, it can include a few other symptoms like poor feeding, a bulge and soft spot on the top of baby's head, vomiting, inactivity, constant crying, stuff like that. The disease incubation period typically ranges 3 or 4 days, but can range from 1 to 10 days. It just depends on the individual. Symptoms tend to develop 3 to 7 days after exposure. Illness usually lasts once treated for 5 to 7 days, or in severe cases, up to 20 days. So, once again, depending on the specific patient. And then decline complete recovery can take up to 2 to 4 weeks, or in severe untreated cases, it can be fatal. Complications can include brain damage, chronic pain, skin scarring, hearing impairment, visual impairment, motor function impairment, depression, behavioral abnormalities, limb loss, coma, and there's several others, but those are the most common. Treatment and prevention of Neisseria meningitidis. The main one is antibiotics, and then of course isolation, care in ICU if needed, and then identifying those at risk who might have possibly been around the infected individual. These treatments affect the progression of the disease. Antibiotics extinguish, kill, in other words, the pathogenic bacteria, which lowers the progression of the disease. Pretty much always needs antibiotics, in other words, but measures that can be taken to limit the risk of infection is being vaccinated is the best strategy to preventing the disease, according to health professionals. And then a historical event that helped limit the spread of the disease is the invention of its vaccine, which was FDA approved in 2005. Since then, rates of this disease have decreased over 90%, specifically in adolescents and teens. However, a social issue we face globally is the lack of healthcare resources in the region of the meningitis belt, like I referred to in a prior slide. So that slightly hinders us from limiting the spread of this disease. Immunity of meningitis, there are 2 vaccine options. The first one, you get the first dose at 11 or 12, and then a following second booster at 16. And then from there on out, you'll receive a booster every 5 years. But if you don't receive the vaccines at those specific ages, the minimum interval between doses must be 8 weeks. It can't be anything less. And then, similar to the other one, you'll be administered a booster 1 year after the series is complete. And then from there on out, you'll receive a booster every 2 to 3 years. So, yeah. And then who is infected? Anyone that comes in contact with an infected individual. So no one's eliminated from this disease. However, being vaccinated does help. Number of people affected. So it's estimated 1.2 million cases worldwide per year. And in 2019, US had a total of 371 cases, which in the whole grand scheme of things isn't a lot compared to other regions like the meningitis belt. Risk populations would include infants, adolescents, young adults, older adults, people exposed to crowded environments, so like college or um, military is a big one. People living in areas that are included in the meningitis belt, like we discussed, and then people with HIV. And then on the right is a little graph of the fluctuation of this disease from years 1970 to 2019. The answer to the question I had included early on as to why numbers of this disease might be higher in Africa than other regions. It's assumed because its environment is more favorable for the pathogen to thrive. So, dry and dusty conditions, travel and large population displacements, and crowded living conditions play a huge role into why cases are more there. My prediction on any future threat of meningitis to human health, I see it improving, absolutely, just from seeing how science research more specifically has exponentially improved. While I think it's going to improve in limiting the risk of infection, I do suspect it continuing to linger, especially in certain parts of the world, like the meningitis belt. And then I just included additional information of the classification of Neisseria meningitidis. And then below is just a quick little video if you're interested in the type of bacteria it is. And it goes over a few things we're really familiar with from our class. So I think that's it. Yeah.